First of all, for Dr. Summers. Dr. Summers, do you have a medical degree?
I'm a clinical psychologist.
I
don't have a medical degree.
Thanks. Do you have a law degree?
No, fortunately.
Okay. I just want to say I find it deeply disturbing, Dr. Summers, that you're making serious allegations based purely on speculation about public health officials in BC profiting from the overdose crisis. I'm reporting facts that have been publicly reported. When those same people have literally dedicated their lives to some of our most vulnerable and voiceless citizens. And I know why Dr. Perry Kendall and Dr. Shaptir started Fair Price Farmer. It was an attempt to address a need that was not otherwise being addressed. In addition, Dr. Kendall is one of Canada's great leaders in public health. I've been fortunate to be a former colleague of his. And I'm sure he would be happy to come to committee to explain Fair Price Farmer. I want to just go back to you, Mr. Perrin. Mr. Perrin, would you describe yourself as a pissed-off partisan ex-staffer?
No.
Perhaps you'd like to clear the record on that one.
Yeah, I appreciate that. Yeah, no, my concern on this issue has grown out of the research that I've done the last several years, and spending most of that time, particularly in my last project, talking to people whose lives have been devastatingly impacted by the criminal justice system, by addictions, by substance use. And all of us have people in our own lives who have experienced this. When I wrote this book, Overdose, I didn't know anyone who'd passed away from unregulated drugs. Now I do. And the very grave concern I have, and the strong comments I've made today, are because I see a lack of adequate response, and it is killing people. And that is what motivates me. And I will continue to speak truth on that, and I'm going to continue to call it out, and I'll call it out whatever the political party is. And so if I'm pissed off, that's the only part. I guess I'm pissed off. I am. I think if any of us were not, that we continue to see people dying in the numbers they are, and we really cared about that, that should enrage us. But it has to motivate us to action.